Okay, so our plan for today, I want to start off with a didactic portion, which is going to be the PowerPoint presentation that's going to just give you an understanding of your lymphatics and how movement and exercise impact your lymphatic health. And then the second half of this seminar is going to be a more integrative component, which is going to be a seated movement class, which is appropriate for all mobilities and all levels. That's going to help stimulate your lymphatic system. So that is our goal. And then again, like Mari said, we'll end with a Q&A. And please put comments in the chat section and questions, and we will have plenty of time at the end to go over that. All right, so give me a moment to share my screen here, and then we're going to start with the PowerPoints. If you guys have any issues with the video or with sound, mention it in the comments, and hopefully Mari can help you out. All right, so lymphatic health and physical activity. Many of you guys have attended my seminars on lymphatics, and so some of this will have some overlap with that, but I do want to make sure that we have new content that's specific to movement and lymphatics. So bear with the slides if you've seen them before, because there will be new content as well. But it is important that we start off talking about what your lymphatic system is, so then you understand how movement can contribute to lymphatic circulation. So your lymphatic system is a very underrepresented system in the body, but a very important system in the body. It's got two major jobs. The first job is it's part of your immune system. So it helps remove waste, it helps filter out any toxins, helps you fight infection, as well as producing white blood cells called lymphocytes to help you fight disease. And so on the bottom of this screen here, you'll see this is a lymph node. This lymph node here is what helps produce those white blood cells and helps filter any fluid that goes through that lymph node. So looking at this picture, you see these little almost like straws going into the lymph nodes. Those are your lymphatic vessels. So over here in the other picture, those lymphatic vessels are these straw-like structures that move lymphatic fluid through your body. So that second job of your lymphatic system involves circulation. You always have fluid out in your tissue spaces, and that fluid is moving. That fluid is bringing nutrients to your cells, and your cells are dumping what they don't want or don't need back into that fluid. So your lymphatic system's job is to move that fluid on a constant basis through these lymphatic vessels and help with circulation and maintaining a proper amount of fluid circulation in your body at all times. So you have many different lymph nodes groups throughout your body, and each lymph node group is in charge of filtering or moving fluid from a very specific part of your body. So they each have very regional jobs. You have your cervical lymph nodes, which are the lymph nodes in your head and your neck region. And those drain fluid or move fluid from what it sounds like, from the head and the neck. You have your inguinal lymph nodes. Your inguinal lymph nodes are in the pelvis area. Those lymph nodes help drain and filter fluid from your legs, from your groin, and from your abdominal and pelvic area. And then you have your axillary lymph nodes. Those are your armpit lymph nodes. And those lymph nodes help filter out fluid from your arms, from the front of your chest on that side, and from the back as well, the upper back area. So looking at this picture coming up here, oops, I skipped over an important picture. So this picture right here, everything in green here is part of your lymphatics. You see the little dots there? Those are all lymphatic vessels. So I didn't mention a moment ago that you also have a lot of lymph nodes in the abdominal area and the chest. Here's the groups of lymph nodes in the armpit, the head and the neck, and the pelvis. And this is not showing every single lymph node in your body. There are more. But look at this network, this net system that is constantly moving fluid through the body. Very important. And in a moment, we'll see how movement really impacts this movement of the lymphatic fluid. So your lymph nodes, like I mentioned previously, help filter out toxins. They're these cute little filters that have a very important job. Your lymphatic vessels are the straw-like vessels that move fluid. similar to your arteries and your veins when it comes to moving fluid, but we're going to talk in a moment how they differ. They're definitely smaller than arteries and veins, and they move fluid a bit differently. And then your thoracic duct. I'm going to go back this slide here and show you the thoracic duct is going to be important in our conversation in a moment. And it runs up the thoracic area. So up here, the chest, down into the abdominal area. It is, if you're local here in Austin, I call it the I-35 of your lymphatic system, which is the major highway system of your lymphatics. It moves the fluid up from the lower body and the mid body up, and then drains it into your venous system or into your veins. So that thoracic duct is very important for your lymphatic system. So right here, this is looking at a cross section of your skin, so we can get a good understanding of where different aspects of your lymphatic system live. So looking at this diagram, we have the outside of your skin, and this is the hair on your skin. And you can see that you've got your hair follicle. So this kind of shows you how deep it goes. And everything in red, those are your arteries. Everything in blue, those are your veins. And then green here, those are your lymphatic vessels. And you can see how they're distributed right there underneath the skin. And then they go through right here is your fat cells. And then they go deeper. So they are very superficial and then run deeper into the body. Now, when it comes to how fluid moves in those lymphatic vessels, right here is a very in-close picture of a vessel, of a lymphatic vessel. On the outside here, you have what's called smooth muscle. So this is muscle following each one of outside of each one of these valves that helps pump lymphatic fluid up. You also see that we have these little valves here. These valves here ensure that as fluid moves up, the fluid doesn't go back down. So it's ensuring that the fluid is moving in the right direction. Now those smooth muscles, they have an important part of the movement of lymphatics. However, your skeletal muscles, the big global muscles of your body, have a very important purpose as well for moving fluid. And that's what we're really going to get into in this presentation today, and why we're going to have our interactive exercise portion as well, is because we need those skeletal muscles. And in the next slide, you'll see where they are in correlation to this lymphatic vessel, but we need those to push the lymphatic fluid up these vessels. Now, lymphatic fluid moves up these lymphatic vessels all the way up the body, and it's a one-way system. So it moves up by our movement, by our muscle contraction, and it ends up dumping up here in the veins, right up here by the collarbone. So this picture right here shows those lymphatic vessels up in the neck area and how they actually insert right into the veins. And that's where your lymphatic fluid ends up. It ends up dumping into the veins, and then it moves through your body the way all the rest of your fluid does in your venous system. So now let's take a look at your actual lymphatic system pumping. Pretty incredible. So this is using a particular imaging called indocyanine green lymphography. So it's using a dye that's called indocyanine green, and it's using an imaging technique that's similar to nighttime goggle vision. And it's injected, the dye is injected in this particular one. We're going to be looking at a hand, and the dye is injected in the web space of the fingers, and then we can actually see through that imaging, we can see lymphatic fluid movement. And I think this is pretty incredible, and I want to share this with you here. So there is lymphatic fluid, and watch it creep its way up her arm. And that's with her not even moving. So she's not even using her skeletal muscles yet. That's just the natural pumping action of that smooth muscle. I'm going to show that one more time. So we're watching that natural pumping action of lymphatics and watching that net of lymphatics move upwards. So the moment that you add your skeletal muscle working, that pumping action increases. So here is your skeletal muscle. So imagine that it's on the outside of those lymphatic vessels that we were looking at. Here are the valves, here's the smooth muscle in the lining, and then these are your large muscles. So if we're talking about your arm, we're talking about your biceps, your triceps. If we're talking about the chest, we're talking about your pec muscles. So all of those large muscle groups that you work anytime that you move, basically. And so it's pushing that lymphatic fluid up in the right direction. So how can we promote a healthy lymphatic system? The very first thing is deep breathing. Remember that thoracic duct that we spoke about, that deep abdominal duct. When you take deep breaths, it helps milk or stimulate that thoracic duct, which helps therefore stimulate the entire lymphatic system. So deep breathing in itself, while you're driving, while you're sitting in the office, while you're sitting in a Zoom conference call, when you meditate, when you take a yoga class, when you exercise, you are stimulating your lymphatic system purely by taking deep breaths. And so we're going to actually take some deep breaths in a moment and practice that. And then also in the class, in the last half of this seminar, breathing will be an important component of that as well. So again, deep breathing. And then exercise, as we've mentioned ad nauseum here, promotes lymphatic circulation. And then staying well hydrated. You need to be hydrated in order to allow for proper lymphatic circulation. So let's practice a deep diaphragmatic breath really quick. Again, you'll go over this in a little greater detail in the class in a moment. But I want you to place one hand up in the sternum area and one hand down in the belly. And then what you're going to do is you're going to take a deep breath in through your nose, and you're going to try to expand your belly out with that inhale, expanding the belly. You don't want this upper hand in the sternum lifting a whole lot. It'll lift a little bit, but you really want that belly to expand. And then when you exhale, not only do a passive exhale, but actually do a little contract of your abdominals to help pump that lymphatic system. So when you exhale, think of scooping your belly button gently in towards your spine, like you're trying to get into a tight pair of jeans. And again, inhale, expand that belly. And exhale, like you're trying to get into a tight pair of jeans. So that in itself, multiple times per day, very beneficial for your lymphatics. All right, so any type of exercise is great for your lymphatics. So I'm not going to tell you that one exercise is better than another, but I can tell you that a few of these particular types of exercises have some significant benefits. So swimming and water aerobics has multiple benefits. The first is it actually reduces your body weight by 90% if you're in at about chest level. And so if you have joint pain, if you're on an aromatase inhibitor or some sort of medication that causes joint pain, if you have arthritis, any sort of bone issues, or any sort of pain, oftentimes, just by getting up chest high in water, you can do a lot of exercises that you wouldn't be able to do otherwise. So that's one benefit of water aerobics, or just getting in the water and moving. Another is that just general movement enhances strength, which enhances muscle tone. And remember, the stronger that muscle is, the stronger that pump is for your lymphatic system. And then we know that the water itself puts pressure on the skin and pressure on the tissues, which also helps move lymphatic fluid through the body. So I think swimming is a very efficient and a very great way to get into an exercise program that's excellent for your lymphatic system. Walking also helps stimulate circulation. Walking is also beneficial. Biking. If you have leg swelling or leg lymphedema, biking on a recumbent bike can be helpful because your legs are slightly elevated. So not only are you using that muscle pump, but you're also allowing gravity to help assist in moving fluid as well. And then yoga. I think yoga, I feel like, is the biggest bang for the buck because you're focusing on deep breathing. You're calming your nervous system. You're stretching any tight tissues or any scar tissue that may be restricting lymphatic circulation. You're strengthening. If you're holding a pose, you're increasing that tone and that strength. So yoga is a really great way to incorporate many different things that will help with lymphatic circulation. But again, every form of movement. And I've been saying exercise, but truly just increasing your physical activity, whatever that may be, dancing, mowing the lawn, or just doing more activity than you did the day before is definitely going to be beneficial for your lymphatics. So there's a lot of information on this slide, and again, I will be sharing this PowerPoint with everybody that's attending today. But in this slide, it was very exciting when this came out. This was actually done by the American College of Sports Medicine in a particular program they developed called Exercise is Medicine. And what they did is they reviewed all of the literature when it comes to exercise, in particular side effects that people may experience from cancer treatment. And the reason I have this slide in the presentation today is one of the side effects they were discussing is lymphedema. And so way back when, before anyone was doing a significant amount of research in lymphedema, people were told, do not move, do not exercise, because that could increase your risk for getting lymphedema, or that could make your lymphedema worse. There was absolutely no research to back that up, and that was absolutely incorrect. And so this diagram, actually, when they compiled the good quality research studies, they found that they were looking specifically, they found the most research on resistance exercise. So that would be weights, exercise bands, things like that. They found that doing it 2 to 3 times per week did not increase or exacerbate lymphedema. And there are studies out there to show that actually it decreases swelling in people who have lymphedema. And it's beneficial to decrease risk for people who are at risk for lymphedema, and we'll talk about the reason why in a following slide here. I've used the word lymphedema several times in this presentation, and for those who are unfamiliar with it, let's talk about what it is. So lymph, we know what lymph means, and then edema is just a medical term for swelling. So you put the two together and it's swelling that's related to lymphatic injury, so it's lymphatic swelling. You can get lymphedema because of removal of lymph nodes or because of damage to lymphatic vessels. Damage of lymphatic vessels can happen from radiation, it can happen from surgery, it can happen from chronic swelling, most likely in the legs. If someone has had chronic swelling for an extended period of time in their legs, sometimes that can progress and turn into lymphedema as well. Signs of lymphedema, first and foremost, is swelling, but before swelling, sometimes heaviness or achiness can be a sign of lymphedema. If you're noticing overnight you weren't feeling heaviness and achiness in an area where you've had injury to your lymphatics, and now you do, you definitely want to reach out to your medical doctor and let them know, just in case you are dealing with a lymphatic issue. In terms of cancer treatment, normally swelling from any type of surgery or from radiation should gradually resolve over time. It is normal to have swelling from surgery and from radiation, but it shouldn't last any greater for most people in 3 to 6 months after their treatment. And every day it should be looking better and better. If it is reducing and then your swelling increases again, definitely reach out to your medical doctor. That could be an issue with lymphedema. Here are just some pictures of different types of lymphedema. Lymphedema of the arms, lymphedema of the chest, lymphedema of the head and neck, and then lymphedema of the leg. The most common cause of lymphedema in the United States is cancer treatment, but there are other causes as well. And when you've undergone cancer treatment, your greatest risk for getting lymphedema is the first 5 years, but there is a risk lifelong. So when we're talking about lymphedema, there is treatment for lymphedema. We can reduce the amount of swelling. We can keep that swelling at bay. There's currently not a treatment to eliminate lymphedema altogether yet, but definitely research is moving quickly, more quickly than it has in the past in that direction, but there is treatment to reduce the impact of lymphedema and the amount of swelling. Now, there are things that we are not in control of when it comes to what increases your risk for getting lymphedema. That includes the number of lymph nodes that potentially were removed for your cancer treatment, the amount of inflammation associated with your treatment, the intensity or the location of your radiation. All of these things can increase your risk for having issues with lymphedema or swelling. However, there are some things we can do that can decrease your risk. Again, we're not in control 100% as to whether you get it or not, but there are some things that we can do. First of all, we know that obesity increases a person's risk for getting lymphedema. And so maintaining a healthy body weight is important. And we do that through exercise and diet. Now, why does obesity increase your risk for lymphedema? It's because fat cells actually produce hormones that are called adipokines that can damage lymphatic vessels and cause leakage of fluid out of those lymphatic vessels. They also, fat cells and these hormones that are released can impair that natural pumping action, those smooth muscles that we were talking about that pump lymphatic fluid through your lymphatic vessels. And then also we know that when there's lymphatic fluid that just sits in the tissue spaces, that actually promotes more fat cell growth. So it's this cycle where we have swelling, it's sitting there in the tissue spaces, that's promoting more fat cell growth, that is further damaging the lymphatics. So maintaining a healthy lifestyle can have a very positive effect on your lymphatic health. If you have lymphedema, and this presentation is intended for people who are both at risk for lymphedema or people who have lymphedema. But this slide, if you have lymphedema, you want to exercise. Do not be afraid of exercising. But these are some things that you want to be cognizant of. When it comes to strength training, you just want to be slow in your progression. You want to be kind to your body because we want strong muscles, but we don't want injury or trauma or inflammation to those muscles or to that area of your body. So when it comes to progressing with your strength training, you just want to progress gradually in the area where you're at risk for lymphedema. So if we're talking about someone who's had lymph nodes removed in the arm, in the armpits or radiation across the chest, then these precautions or these considerations are specifically for the arm and the chest and the upper back on that side. If we've had damage to lymphatics in the pelvis, then these precautions or these things that you want to be cognizant of need to be for the legs or for the lower abdomen. So it's specific to the region of the body where your lymphatics have been injured. When it comes to progressing slowly, what we mean is you don't want excessive muscle soreness in that area. So the way I like to monitor that is just asking myself, can I do the same exercise tomorrow? Right? If you've gone a little bit too fast in your progression and you're so sore that you can't do the same exercise the next day, that just means back off just a little bit, okay? But we definitely want you exercising. If you have lymphedema, you want to wear your compression garment when you're exercising. If you are unfamiliar with a compression garment or you don't have one, definitely need to find a lymphedema therapist to help you acquire one if you have lymphedema, okay? Resistance exercises have been reported to decrease the swelling in those that have lymphedema. Again, do wear your sleeve or your compression garment when you're exercising. And then another good rule of thumb is when you're doing resistance training, you want to increase your repetitions before you increase the weight or the resistance. So as an example, let's say that you're doing, one set of 8 for a bicep curl. And you have lymphedema in your arm. The next thing you want to do is go up to 2 sets of 8 and then 3 sets of 8 before you even consider increasing the weight or even starting to use a weight. And then you can increase your weights. There's no limit or no contraindication to how much weight you can ultimately lift as long as you're following this gentle progression. Just a quick overview, the intention of this presentation is not to go over what lymphatic treatment is. That is something where we have other videos on our website at Cancer Rehab and Integrative Medicine specific on treatments. But I do want to demonstrate here that exercise is a part of treatment for lymphedema. And now you guys know why, right? Helping promote that lymphatic muscle pump, helping maintain a healthy body weight. But other parts of lymphatic treatment include manual lymphatic drainage, which is a manual technique that a lymphedema therapist would do to help reroute fluid, to help move fluid and stimulate that pumping action of the lymphatic system. And then some form of compression. Sometimes it's a compression garment, and in more severe cases may start off with multi-layered bandaging and then ultimately progress to a compression garment. And then exercise. If you are receiving treatment for lymphedema and you have not been taught an exercise program, you have not been told by your therapist about doing an exercise program and finding the right program for you, definitely have a conversation with them, because it is, sometimes it's missed or not discussed, but again, imperative. If you are noticing signs of lymphedema, reach out to your medical doctor first. They will clear any other concerns such as blood clots, infections, cancer recurrence, and once they've cleared any of that and they feel that it's lymphedema, they will refer you to a lymphedema therapist. Or if you're searching for one yourself, you'll get this slide in the PowerPoint that I send to you, and these are some links to find a certified lymphedema therapist in your area. Now, I do have to promote exercise in general. We've talked about lymphatic health, but let's also talk about everything else exercise can do for you, because ultimately, we have these lofty ideas. Yes, we're going to exercise, but I think what actually gets you to do it is an understanding of how powerful of a medicine exercise actually is. Exercise decreases fatigue, decreases depression and anxiety. I know we're all dealing with depression and anxiety right now. It improves mobility, helps with weight gain or weight loss. So in your treatment, if you're dealing with weight loss, you're probably losing muscle mass. And so weight gain is important. Exercise can help with that. Bone density, most cancer treatments do actually create bone density issues, and so exercise helps. Circulation, we've spoken about that in lymphedema. Joint pain. There was a study that came out a few years back specific to the joint pain that is a side effect of aromatase inhibitors, which is a medication that some people with breast cancer are on, and a consistent exercise program can reduce joint pain by up to 30 to 40%. Balance issues, self-esteem, sex drive. And then this slide, I think, is the most important. Improves quality of life, improves the efficacy of your cancer treatment. So if you're still undergoing cancer treatment currently, exercise helps the efficacy of the treatment itself. It improves your survival rate. It decreases your risk for cancer recurrence, and it helps pump up your immune system. All right, so I do want to give a little promotion to our free exercise and wellness classes that we offer. We have a class almost every single day of the week via Zoom. We know you guys can log into Zoom because you've done it today. It's the exact same process for all of our exercise classes, and we have classes for every mobility level and any type of exercise you may be interested in. Today's class that we're going to do in the other half of this seminar is a chair movement class, and again for all mobilities. And I wanted to let you guys know that we have a chair yoga class, and next month we're going to start a chair Pilates class as well. So I want to make sure that anyone and everyone from any mobility level has a class that's the right fit for them. And that is on our website, our entire class list, and hopefully after today's seminar you guys are going to be pumped to get into an exercise program from the safety and comfort of your own home virtually, and again for free. This is what we provide for our cancer community and for our lymphedema community as well. You do not have to be dealing with cancer to take any of these classes. All right, so again, any questions when it comes to this didactic portion that we just did, please put them in the comment section. And our next thing is we are actually going to sit here and do some movements. So Naomi Aaronson, I'm very excited that she's collaborated with us. She lives in New York City, and she has a specific exercise and movement class that's designated specifically for lymphatic circulation. And she calls it BAP. B for breathing, A for alignment, and P for posture. And so we've pre-recorded this class, and I'm going to play it for you guys. Hi everyone, and thanks for attending the second half of our Lymphatics and Movement seminar today. I would like to go ahead and introduce our movement instructor. Naomi Aaronson has been an occupational therapist for 30 years, specializing in rehabilitation of the upper extremity. She has worked with breast cancer patients post-surgery, as well as women who have had breast reconstruction. After a car accident, Naomi discovered Pilates and found that it benefited not only her, but her breast cancer patients physically, emotionally, and cognitively. As co-author of the book Pilates for Breast Cancer Survivors, A Guide to Recovery, Healing, and Wellness, Naomi has sought to share the benefits of Pilates for survivors throughout the world. The book has been published not only in English, but in Spanish and Chinese. Welcome, Naomi, and I hope everyone enjoys the second half of the class with our movement session.
Thank you, Angela. So today I'm going to build upon Angela's presentation, and we're going to be using breathing and movement to enhance lymphatic flow. Now, there's a couple of things that I just would like to remind you about. If you find that things are a little bit too strenuous, feel free to stop what you're doing and rejoin us when you're able to. Also, work at your own level. It shouldn't be painful, so work within a pain-free zone. If you do have lymphedema, please be sure to wear your sleeve, and if you have a gauntlet, the two of them as well. Now, if after you've noticed after this presentation today that maybe your arm feels heavier, it looks more swollen, maybe it's painful, if you haven't been exercising, that might be because we're really doing something that your body's not used to, so see your medical provider. Because if your arm isn't used to this, it might just be too much too soon. So you want to really be careful if it's your first time of really doing any exercise. So today, as I mentioned earlier, we're going to be focusing on 3 things, okay? So I call it BAP. So breathing, alignment, and posture. The first thing we're going to be working on is posture. Now, why during a lymphedema or exercise session are we talking about posture? And posture is really important because if you're like a lot of people today, you're working at a desk, you're hunched forward, after you've had surgery, you may have protected the arm, which is a natural reaction, and the back tends to flex, the arm tends to come in, so we want to open you up. And so that's why posture is important and alignment's important. So before we start, and we're going to be starting the exercise portion with breathing, we have to get everybody set up. So the first thing is, with posture, is a neutral pelvis. Now, what's a neutral pelvis? So I'm going to move to the side, you don't have to. And a neutral pelvis is halfway in between what we call a posterior tilt and an anterior tilt. So if you sit like this is a posterior tilt. You can see my pelvis, this area here is back. Now, if you sit anteriorly, which is me, I have a gap here, and I tend to really kind of enunciate that. That's not good either. So the place that we want to be is called a neutral pelvis. So what is a neutral pelvis? So a neutral pelvis is halfway in between that posterior and anterior tilt. So if you place your little finger of both hands and your ring finger on your ASIS, and that's your hip bones here. So, and make a heart. And right in the middle of your heart, is your belly button. So we're making our heart here. So if we move our pelvis back for that posterior tilt, our thumbs come down. That's not good. Now if we move it forward so our thumbs come back up, that's anterior tilt. And you could feel like tension in the lower part of your back. That's not good. We want it to be the same plane. We want our thumbs and our index fingers to be on the same plane. So let's try that again. We're going to move back. So our thumbs are down, our index fingers are higher. And then if we move forward, our thumbs are higher and our index fingers are lower. But we want everything to be on the same plane. Now, what does that do? That puts you in an ideal posture, and that's a goal. It's hard to achieve. And today's class will be sitting and using our core, and that's where the alignment comes in. So what I'd like you to do is move forward in your chair so everybody's feet should be on the floor. Now, let's start from the head. So our ears should be over our shoulders. Our shoulders should be over our hips. And now you can move that pelvis forward and back to get that neutral pelvis. Now, if you find that you're uncomfortable, you could also place a pillow behind you to support your back, because we will be using a lot of our trunk here for support. Now, if you draw a line down your ASIS, those are your hip bones, our legs should be hip width distance apart. A lot of times we think our hips are bigger than they are. So that's why I'm saying to draw a line down, and then under your knees will be your ankles. So we want everything to be hip width distance apart. Now, you should place weight on your feet. And I have very high arches, so I have a tendency to kind of go to the sides of my body. Now, why do we want to place weight on our feet? We recently had a storm here in New York and New Jersey, and a lot of trees came down. And what I noticed was that the trees that were dead in the middle, so their core weren't strong, were the trees that ended up falling down, and we had so many cars that were split in half because of that storm. So place weight on your feet. Think about weight on all your toes and all your heels while we're in that good, ideal, neutral pelvis posture. And remember, the ears over our shoulders. Now, why do we want to be in that alignment again as well? Well, think about your head. If your head is forward from working on computers like this, for every inch that your head is forward, your head is like a huge weight. So we want those ears to be right over our shoulders. We don't want the head to be too far forward. If the head is too far forward, then this is what happens. Now, why is that bad? That's bad because we're not allowing our lungs and our diaphragm to fill up. And we want to get utmost benefit from our lungs. Now, this part here, the core that I was talking about before with the tree, if this part isn't strong of our tree, we don't have good roots, and that's where our feet are, then we're going to end up flailing in the wind like a tree. So that's why we need to really get those feet into the earth, really get those roots into the earth, weight on both feet and on your heels and your neutral pelvis and everything lined up. Okay, now that we've got everything lined up, we can start to breathe. Now, if you're sitting forward, you're going to feel like, wow, this is a lot of work here because we're really holding up this part of our body. But thinking back to that tree has to be able to hold up itself, right, by its roots and be able to maneuver in that wind. And our bodies have to do the same thing too. We have to be able to support ourselves and balance ourselves. So that's why strengthening this area is important. Also activating our diaphragm is important. But many of us don't do that breathing part. We think we're breathing, but sometimes we're not breathing properly using our diaphragm. We're using these muscles here, or the muscles in our neck. So let's try and see, how do we breathe? Let's place one hand on our chest, one hand on our abdomen. Close your eyes, and we're going to inhale through the nose and exhale through the mouth. Inhale through the nose, exhale through the mouth. Inhale through the nose, exhale through the mouth. Inhale through the nose, exhale through the mouth. You can open up your eyes. Now think about it. Where did you feel more movement? Did you feel more movement in the chest, or did you feel more movement in the abdomen? If you're doing diaphragmatic breathing, you should feel more movement in the abdomen. It should fill up like a balloon. A lot of us are what's called shallow breathers, which means that we're really focusing on using these accessory muscles here in the chest and the neck. We really want to focus down here. So let's try that again. Place one hand on your abdomen, one hand on your chest. And let's see if you could bring a lot of attention now towards the abdomen and really try and make that balloon in the abdomen really fill up as you inhale. And then as you exhale, you should feel it come down. So we're going to inhale through the nose. And now exhale through the mouth. Inhale through the nose. Exhale through the mouth. Two more times. Inhale through the nose. Exhale through the mouth. Last time. Inhale through the nose. Exhale through the mouth. We don't think about breathing, but we need to bring more focus to it. So we do feel movement here, but you should feel more movement here to get that diaphragmatic going, breathing going. Okay, so let's, thinking about that breathing now, we're going to be working the trunk. And that's this part of the body here. So get your roots down, gather your roots. You can place your hands behind your ears like so. If that's too much, you can place your hands here. So those are some options. So now we're going to come forward. I'm going to show you. We're going to come forward from the hips like so, and then come up. You'll be surprised at how much that activates the muscles there. So we're going to inhale, and now exhale forward, inhale back, exhale forward, inhale back, exhale forward, inhale back. Two more, exhale forward, inhale back. Are your roots still secure? Exhale forward, inhale back. Good. Okay, you can place your hands here if you find that you're getting tired. Now we're going to do what's called rotation. If you have osteoporosis in the spine, I would advise you to continue with it or what we just did before, but we're going to turn. So we're going to turn our whole bodies. Be aware, your hip bones are like headlights. Keep those headlights focused ahead of you. So you can place your hands here or else here. Those are some options. We're going to inhale, and as we exhale, we're going to turn to the right. As we exhale, inhale forward. Good. Now we're going to exhale to the left. Exhale, turn to the left. Inhale, forward. Good. Turn to the right. Exhale. And now inhale. Good. Exhale to the left. So we're turning to the left. The head turns as well. And then forward. Last time. Exhale to the right. Keep those headlights shining forward. Inhale forward. Exhale to the left. Inhale forward. So you should feel the muscles in your abdomen really working. Now, we're going to place our hands here for this exercise. We're going to bend to the right, like so. If you have osteoporosis, I would continue with those other exercises. And now inhale up. As you inhale, think of yourself getting nice and tall. Exhale to the left. Inhale up. Are your feet moving? Make sure to keep those roots in. Exhale. Inhale. Exhale. Inhale. Get nice and tall. Exhale. Inhale. Exhale to the left. And inhale. Good. You can place your hands down. They might be getting tired now. Okay. Now we're going to move on. I'm going to move on to the neck. Now just make sure that you're still in alignment. You can check yourself in the Zoom video there. Okay. So now we're going to combine the breathing again with some neck movement. We gradually move down the body. So the first thing we're going to do is neck movement. We're going to inhale, flex your neck to the right as you exhale, and inhale up. Good. Exhale to the left. And now inhale up. Now you may find one side is more limited. Exhale, which is totally normal. Inhale. You may find that the affected arm might be more limited toward on that side of your affected arm, or even your dominant arm. Inhale, exhale, ear to shoulder. Inhale up. Exhale to the left. Inhale up. Are your headlights still shining? Exhale. Inhale. Exhale. Inhale. Now, did you notice if your shoulder was going up? Let's try that again, and let's try and see if we can keep that shoulder down as we bring our ear to the shoulder, so that opposite shoulder stays down, and then bring it up. Inhale. Exhale. And bring it up. Last time. Exhale. Bring it up. Exhale. And inhale. So you may have noticed tightness. Now, what we're going to do is we're going to rotate. So we're going to turn again to the right. So we're going to just use our neck this time. So inhale. Exhale, turn. Try and look over your right shoulder. And inhale, back to center. Exhale. Turn to the left. Is that opposite shoulder coming up? Come back to center. Good. Turn to the right. Rotate to the right. And center. Rotate to the left. Exhale. Inhale. Last time. Exhale. Inhale, back to center. Left. Back to center. Good. Now what we're going to do is I call it a clock. So we're going to rotate the neck around in a clock. And you may notice as you go around the clock, so the clock 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, you may notice tightness in one part as you do that. So the whole purpose of this is really to loosen everything up to get your breathing and coordinate the breathing with the movement. So let's start by inhaling. Nice and slow, we're gonna go clockwise. Inhale, exhale, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Let's do that again. Now, it's not necessarily to look back. Just think about moving just nicely in a circle. Inhale, exhale, around, 5, 6, 7, 8, 9, 10, 11, 12. Now we're going to go counterclockwise. So that's the opposite direction. So now inhale, exhale, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Back to center. One more time. Inhale, exhale, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Okay. We just as a society, we tend to get a lot of tension here. So the next exercises are really designed to help get rid of some of the tension. You can place your hands by your sides, and we're going to inhale, bring our shoulder blades up to the ears, and exhale, slowly bring down. So our fingers are pointing towards the floor, reaching towards the floor. Inhale, and now exhale, fingers reaching towards the floor. Keep those roots activated. Inhale, shoulder blades up to the ears. Exhale, all the way down. Fingers reaching for the floor. Last time, inhale. And now exhale. Slowly bring down. Now the next exercise is a little tricky. And this exercise, you don't need to turn. I'm facing this way. And it's called protraction and retraction. Why am I focusing on this exercise? Because it activates the muscles in the back. And that's where we tend to be weak. So we're going to inhale, reach forward like we're hugging a child. And then we're going to use the muscles in the back and bring the elbows back. Reach forward as you inhale like you're hugging someone. Exhale, bring the shoulder blades together so they're not really kissing, but they're getting close. Inhale. So you don't want to come back using those muscles. You want to use your back muscles. So this is a workout because we're sitting nice and tall as we do this. Inhale, reaching forward. Exhale, bringing those shoulder blades closer together. Okay, you can bring your hands down. And now we're going to do a circular movement. So you'll be thinking about making a circle with your shoulders. We're going to start with the right. So arms to the side, we're just going forward, up, back, around. So we're combining some of those movements we just did. Inhaling and exhaling. Inhaling and exhaling. Inhaling and exhaling. Are you losing those headlights? Now left, 1. Inhaling and exhaling. Inhaling and exhaling. Last time, 1. Now we're going to do both. So really think about it. You're making a circle. Think about you're making a circle. It's like a counterclockwise circle there. So inhale, sit nice and tall. Exhale, shoulders forward, up, back, and around. You should feel that your body's getting taller as you come back around. Inhale. Exhale. 2 more times. Inhale. Exhale. Last time. Inhale. exhale. Okay, you can bring your hands to the side, and we're going to Velcro your elbows to your side. And think about it like a book opening up or a door opening up. So we're going to open that door and then shut that door. So inhale and exhale, slowly shut it, nice and easy. Inhale and exhale. Inhale and exhale. Inhale and exhale. Last time. Inhale and exhale. Good. Now we're going to start working on the arms, the shoulders. So this might be a good time to take a break if you feel that you're tired. All right. And you could also kind of do those if you feel like you're getting tight as well. Okay, now we're going to bring our arms forward. So they're at about shoulder with distance apart, and they're at shoulder height. Now, if you find that this is too much, because there's a lot going on here, we're really trying to sit up nice and straight, we're doing a lot of activation. So if you find that you need to stop, that's fine. Now, think about that image of the book opening up. We're going to open up like so. Feel yourself getting taller. Now, you should be able to see your arms in your peripheral vision, so don't go too far back. Inhale. And now exhale. So thumbs are up. You should be able to see your arms in your peripheral vision. Inhale. And now exhale. Thumbs are up. Inhale. So close that door, those doors. Open those doors. Close those doors. Open the doors. Last time. Close those doors. Open the doors. Now breathing in, sitting up nice and tall. Feel yourself getting taller. Thumbs are up. We're going to do some arm circles towards the screen. So we're inhaling and exhaling. 1, 2, 3, 4. Now the other way. 1, 2, 3, 4. And you could bring your hands down as well. Now we can take a little break. And you could bring your hands, your elbows back to your sides. Now all we're doing, this is a simple movement, is we're working on posture. So we're going to inhale and just bring your elbows back. So you should feel your back activating. And then come forward. Bring them forward. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Last time. Inhale. Exhale. Good. You can bring your hands down. Okay, so we're going to use the shoulders and the arms a little bit more. We're going to bring the right arm forward up into the air gradually. So, and then our left arm down. So fingers are pointing towards the earth. So gradually bring the right hand up and the left hand down. So you should feel a nice stretch here in the axillary area. Inhale, and now exhale, try and stretch more. Try and get taller. Think about that image of the tree. Inhale. Exhale, lift up. Nice and tall. Now thinking about that tree kind of bending in the wind, we're going to go up and over to the opposite side, feeling that nice stretch in that area. Okay, fingers reaching for the earth, and then come back down, and you could just take a little break because that's kind of a strenuous type of exercise, like a whole body type of exercise. We're going to work on the other side as well. But please feel free, if you do need a break, to take that break. So we're working on really trying to strengthen muscles in the back, stretch muscles here in the chest, and in the axillary area. Let's take some breath, inhaling and exhaling. And now let's bring the left arm up, gradually inhaling, and the right arm down. Fingers reaching for the floor. Inhale as you reach nice and tall, and the right arm is down, so the left arm is nice and tall, reaching for that ceiling, feeling yourself gaining height, growing. And now inhale, try and stretch up even more. Feel that body, feel the lengthening here. And now inhale, exhale, up and over to the opposite side. Now as you go over, make sure that your left hip stays on the chair. We don't want that to come up. And now come back down. And we could just circle like so. Just okay. Good. Now bring the arms back up so they're about shoulder height. If you need to have them down, that's fine as well. We're going to exhale and make like a stop sign, and then bring it down. Inhale, and now exhale. Inhale, and now exhale. Good. Two more. Inhale, exhale. Last time. Inhale, and exhale. And now you can bring your hands all the way down for a little break. Swimming is a really good exercise for lymphedema. So we're going to do some pretend swimming. And the first stroke that we're going to do is the breaststroke. So you're going to bring your arms up to about breast height. We're going to push the water away and then come back in. So remember, as you push, make sure you keep it within your peripheral vision. So inhale and exhale. Push that water away. Inhale. Exhale. Push it away. Two more times. Inhale. Exhale. Push it away. Last time. Inhale. Exhale. Push it away. You could bring your hands to your chest. And now, are you in the same position you started at? Are your feet rooted into the earth? Is your pelvis neutral still? Are you feeling nice and tall? We're going to work the back now. Now, the whole thing with the back is a lot of people use their neck. What I want you to think about is really lifting your chest towards the ceiling and then come back. There shouldn't be any pain. If you do experience any pain, less is more. So I'm doing less here and then coming back. So I'm extending, I'm lifting my chest towards the ceiling. Now let's just hold it there. Let's take some deep breaths in, inhaling and exhaling, inhaling and exhaling, inhaling and exhaling, and now come back to center. Okay, bring your hands down. Now you could do this next exercise however you feel. You could start here, you can bring your arms down. But what we're going to be doing is just bending and extending. Bend and extend. Inhaling and exhaling. The thing with Pilates breathing is it's very confusing, but the most important thing is that we continue breathing, using that diaphragm, working our core, strengthening the trunk of our body. 2 more. Inhaling and exhaling. Okay, good, last time. Now, we're going to work on the wrist. Now, this movement is like a figure 8. We're going to start at the right. So I'm going to be making a horizontal figure 8. Now, again, you can get your shoulder involved. You can get the wrist involved. If you don't want to, you can place your elbow by your side, like so. Inhaling and exhaling. Inhaling and exhaling. Inhaling and exhaling. 2 more. Inhaling and exhaling. Last time. And now put that hand down. Feel free to take a break. Remember that. Okay. Get those roots into the earth. Now working the left. So we're going to be making that horizontal figure 8 or infinity sign with the left. So inhaling and exhaling. Inhaling and exhaling. Inhaling and exhaling. Drawing that figure 8. You can make it bigger if you want to, or you could even make it smaller if you want to. It's up to you, however you feel. So you've got a lot of options. Okay, good. All right, now we're going to go on to the fingers. So let's start with the right hand. You can place your left hand like so. And we're just going to touch each finger to the thumb. Nice and slow, inhaling and exhaling. Nice and easy. Last time, inhaling and exhaling, inhaling and exhaling. Now make a fist. And let's imagine that you're spreading fairy dust all over. So we're going to spread fairy dust all over. Fairy dust all over. Fairy dust all over. Fairy dust all over. Now moving on to the left. So let's work each finger. Inhaling and exhaling. Touching each finger to the thumb. Last time around. Okay, make a fist and spread your fairy dust. Spread your fairy dust. Spread your fairy dust. Fairy dust. Fairy dust. Now both hands, we're gonna be spreading fairy dust all over, all right? So, to the ceiling, to the floor, to the ceiling, to the right, to the left, down to the right knee, down to the left knee, all the way up, to the right, to the left, to the right, and now finally come back to center. Bring both hands together, inhaling and exhaling. Inhaling and exhaling. Inhaling and exhaling. Inhaling and exhaling. Now bring both arms, lace them together. Inhale, up. Now imagine you're that tree, that really big tree. Feel yourself growing tall, taller, tallest, all the way up, or both headlights facing forward. Hold it there. And now you're a very strong tree, but you can bend to the right. Keep that left hip on the chair as you exhale. Now inhale, exhale to the left. Keep that right hip on that chair. And now come back to center. Bring both arms down. And let's just do a couple of stretches just to end. You can place both hands here. Now, if you do have osteoporosis, you can do that one, the this one where you're lifting the chest. But if you don't, we're going to round our backs. So we're going to going into that posterior tilt to stretch everything in the back out, and then slowly coming forward. So rounding. So we're releasing everything and coming forward. Rounding. Coming forward. Last time. Rounding. Coming forward. And just inhale. Exhale up. And then press down. Press your arms down. Inhale up. Feel yourself growing. And press down. 2 more times. Inhale up. Feel your body growing tall again. And press down. Last time. Inhale. And now exhale. Press down. And bring your arms to the side. And just shake everything out. Just shake it out. Feel like a rag doll. You should feel like a rag doll, letting everything loose. And I'd like to thank you for your attention today.
All right. So thank you guys for joining in on that class, and so grateful to Naomi for sharing her class with us today.